Hello, everyone. So, welcome to the first episode of Persivia Perspective. And today we have Nehal Ijaz with us, who is the Senior Business Analyst at Persivia. And we are going to be talking about the new changes in the teams model today. So, let's start. So, Nehal, my first question to you is, how does the new transforming episode accountability model team align with previous models like the CJR and BPCI? And what are some of the key differences?
Right. So, first of all, thank you so much, Nita, for having me on this Persivia Perspective. And I really wish you all the best for this new initiative. So, yeah, much hype about teams going on at the moment, transforming episodic new model. So, earlier we used to have BPCI and CGI. BPCI stands for Bundle Payment for Care Improvement, and CGI stands for Comprehensive Joint Replacement. So, both of these were episodic models. And what happened in these model was that when a patient gets admitted to a hospital, and after the process and everything, he gets discharged, and then he's been taken care for like 90 days. So what happens in those 90 days would be covered by a bundled payment. So this was the key feature of bundled episodic models. So now we have team model coming up, which is going to be starting from 1st January 2026. And it is particularly focusing on 4 to 5 different surgical groups. And one of the key features of this model is that it will be focusing more on 30 days rather than 90 days. So this is one of the key significance over here. And the other thing which I mentioned earlier is that they'll be looking at 5 different surgical groups. Whereas when we look at the BPCI or CGR model, it used to be having a large number of episode groups in that.
Thank you so much, Nehal. So my second question is, the BPCI and CJR, and can team all of them run together? Like, can the organizations participate in all of them, or do they have to pick one of them?
Well, this is a great question, Nida, because I really think this is one of those questions which is going in everyone's mind, everyone linked to the industry at the moment. So earlier, what happened with the BPCI and CGR model was that a participant or maybe a patient was only linked to one of the programs. They cannot be enrolled into another program, and if they get enrolled into another program, they automatically got dropped off that program. So what we are looking at team model is that they are putting in some leverage on this behalf, and a person can also participate in another primary care model as well. So more likely, if I could explain it in a timeline form, is that let's suppose a patient XYZ comes in and he's having his primary health services being done, and he has to go through those 5 particular surgical procedures, which includes major bowel procedure, spinal fusion. So whenever he will be admitted into those surgical procedures, he would have to go through the team model specification. And once he is done from that, he can be enrolled back into his like primary healthcare, and the physicians are there to refer him back to primary healthcare as well. So looking forward, what I think is that it will be having some leverage to participate in multiple programs, unlike BPCA CGR.
Thank you so much, Nehal, for explaining that. My next question is, what are some of the benefits of team model?
Benefits of team model. If I could only like tell you about the benefits of a team model, I may be underestimating BPC and CGI. BPC and CGI have also done wonderful work for us. So whenever, let me just give you a theme, Nida. So whenever there is an episodic bundle payment model, what happens is that physicians as well as non-physician staff as well as the hospital staff, everyone is aligned to one goal, and that is patient's care with the least amount of dollar spent, right? So this is the basic theme. Now, what happens when we focus on this is that the quality is improved because everyone works with more cohesiveness. They are more like openly communicated together. They are more bounded together. So what happens is that everyone tries to care the best he or she can do. And this is how it is one of the basic benefit of episodic models, that everyone works in line on a single goal. So coming to teams particularly, what I am expecting in 2026 is that for these particular five different surgical groups, which are mentioned in teams model, a specific, you can say, specialty care would also be given to these five major procedures, which are surgical procedure. And the other thing is that they'll be having 30 days as well after the procedure. So much more patient care would be given. And then the other thing about this Teams model, which I'm thinking as a benefit, is that they'll be looking at the patient for like 30 days after its surgery. And this was greatly help in reducing the readmission rate as well. So they'll be trying their best that no readmission occurs in those 30 days and the model goes pretty well. This would increase the more care for the patient particularly.
Thank you, Nehal. You've explained the benefits for every program. So, given the mandatory nature of Teams and the fact that it is starting from January 2026, what immediate steps must the hospitals take now to avoid being unprepared when the model goes live?
So, as we all know that the Teams program is being starting from 2026. So we don't really have much time, what I think, because like such transitions are hard to implement, no doubt. But a few steps which hospitals can particularly take at the moment are that they should be much more comfortable with the bundle payment model. Their physicians should be much more comfortable with the bundle payment model, and more or less they should be adopting the treatment cycle for this particular program. Like there should be more patient engagement through education process as well. There should be more data analytics, more data going on. The doctors which are specifically trained for their medical profession, they should also be given some trainings related to data analytics and how the data would come, how should they look at the data to improve their quality of work. And the other thing is that they should be also collaborating with the payers to align financial incentives as well, because as we know, dollar amounts are also attached to this program. So this is also one thing. And then the other thing, which is much more important from the hospital perspective, is that they should be also continuously giving training to their staff as well on the episodic care models, not just teams at the moment. They should be starting from like BPCI or CGR, or much more in a picture that they should be giving about episodic bundle payments so that they are aligned with that. And then the last thing is that they should be having some feedback loops as well so that they can continuously improve their process and plug the loopholes.
Sounds great. Thank you for telling us about the urgency of Teams model. So I also wanted to ask you about the significant changes that are coming in Teams.
Significant changes which are coming in teams is that they, as I mentioned earlier, they'll be having five surgical groups only, and they'll be having 30 days of दोबारा. Okay, so they'll be having क्या कहा था significant ना हाँ. Okay, so the significant changes coming up with the teams models that they'll be having 30 days post-discharge treatment time, and they'll be looking at the episode, its cost, its care, everything would be covered for upcoming 30 days. And then the other significant change is that it is for 5 years and it is mandatory. And the other thing is that it will be having 5 different surgical groups. So much less amount of group, but the urgency as well as the importance is of great nature.
So you've mentioned the significant changes of teams, but what does this mean for hospitals and why should they be prepared for this? And also, what are some of the challenges that hospitals might face when they're implementing this model?
Right. So teams, as I've also mentioned, that it is going to be mandatory from 2026 till 5 year onwards. So hospitals need to be fully charged for this, as they'll be having no option, particularly particularly those hospitals which will be selected for this program based on the statistics data by US ministry. So what happens over here is that they'll be facing some challenges, because if someone is starting it for the first time, they won't be much more aligned with the data. The physicians won't be aligned with the practice of episodic or bundle model. So as I mentioned earlier, they'll be needing to have some more education on this, more trainings and more data visualizations as well as data analytics, because all of these episodic bundle models are purely data analytics. You have the data, it is coming in, you should be having great resources, you should be having great visualization tools, you should be knowing what the data is actually saying to you, because the numbers will be huge, the counting will be huge. You should be good enough to interpret the data and implement it on your staff and the patient as well, so that you know where the dollar amount is going, where the dollar amount needs to go, and what's going on. And then the other thing is that driving equitable outcomes would also be much challenge for this, because it would be a new program. So maybe in the first few months or so, the data won't be that good, the outcomes won't be that good. So adaptability is a key factor in this. And then the other thing which everyone likes to prefer in healthcare industry is that lowering the Medicare spending. That would be a key challenge, because everything would be aligned for the first time. So these are few of the challenges. Let's see what's going on when the program starts.
So speaking about the challenges and educating the hospital, that our hospitals should educate themselves, they've also mentioned about implementing a climate change policy. So what does that mean?
Right. So one of the salient features of this program, particularly, I think for the first time, and that is that they are voluntarily also including a climate change policy with this program. So what does that mean is that they'll be looking at the hospital wastage, which can affect our climate, and they'll be monitoring that data, they'll be assessing that data, and then presenting different reports. And they'll try, what they have mentioned in this program is that they'll try to reduce all such emissions which are harmful. And a survey which I was going through was that in United States in 2018, the greenhouse harmful emission from hospital accounted for an estimated 8.5% of total domestic greenhouse gas emissions. So
Whoa.
this is a huge number. And if I look at the globally stats, the healthcare industry accounts for between 4.4 to 4.6% of worldwide emissions. So this is a huge number. Let's just multiply it by a few years or so, and we can imagine where the things are going in the upcoming years. So I think it's a great initiative which they have started for the reduction of harmful waste. Or maybe step one is that looking and assessing at those waste and how can it be reduced, and so it's a voluntarily good model. Let's see how does it goes on.
So Nehal, who is going to decide that which hospital participates in this program or not?
Okay, so Teams model would be mandatory, but all those acute care hospitals located within the mandatory core-based statistical areas, CBSAs we call them, which are selected by CMS, will be up for model implementation, and they will be required to participate in the team. And apart from this, CMS will also give one-time opportunity to those hospitals who want to participate, which are like participating in the BPCI and CGR program till its end. So they'll also be given an option to participate voluntarily in this program. But all those hospitals which lie in a particular core-based statistical area decided by CMS, they would be mandatory for participation in this.
Thank you, Nehal, for letting us know that. So how critical do you think real-time data analytics in meeting teams' objective will be? And what could happen if hospitals do not invest in the necessary technology and expertise?
Oh, Nida, this is one of the key questions, I think. Not investing in the technologies and not understanding the data, it would be a huge disaster for everyone participating in this program. Because as I already said, that data is the key of this program as well as episodic programs. So what happens is that this program, as I mentioned, is also, like as the name says, transforming episodic model. So they are basically transforming from BPCI and say CGR. So the hospitals are much more aligned with this, that how does BPCI and CGR work and how would the data mean for them. So there is a great opportunity in this to learn from the data, because what happens over here is that the real-time data is something which can guide us and navigate us for the upcoming days. Now, let's suppose a patient is being treated and an XYZ dollars of cost is being spent on him. But we can also look at the criticality factors. We can also look at the physician performance as well. And we can also look at what really happens when it goes into readmission, or what happens when he's going through a surgery or procedure. So we can track its spend, we can track our physicians as well, and we can guide them like with the existing data. And the other part of your question was investing in technologies. This is where the investment in technology also comes, Nida. Like imagine I am sharing some numbers with you and you don't have some updated models like machine learning, artificial intelligence, which can like guide you on the upcoming days as well. So you'll be standing nowhere. Jokes apart, not really you, but data would be meaningless if we don't really have the necessary tools and programs. So data as well as investment in technologies is of great importance in this program.
So how does Persivia, how can they help you in this? And how can we see, your data going live or everything that you've said? And how can we show them the analytics, the performance and everything?
Right. So Persivia is having great and vast experience in episodic bundle programs. So they are operating since like last 7 to 8 years in this particular, and they have a specialty in BPC and CGR as well. So Persivia has great experience and expertise in this particular field of episodic as well as analytics model. So we currently possess like 15 years of experience in demonstrating the data analytics to our clients, as well as looking at the episodic models, particularly the BPCI and CGR. Team has really worked well on this. And if I could give you an example of Prime Healthcare, they are one of our distinguished clients, and we are working for BPC and CGR for Prime Healthcare. And what I really think is that we have really showed them how the data is particularly going on, what are their spend like, how does the patient look like when it's come, how does the patient look like when it's being treated, what are the dollar figure going on, how's it everything going, and at the end of the day, how much money did they make or how much money did they lose, and what are the key factors if they lose some money, so where they can plug them. So what happens over is that this is all of the data analytics part, and we particularly show our clients in the form of dashboards. We have ad hoc reports. We have some manual reports as well, which are created based on an urgent requirement given by our distinguished client. So this is how things are going on. And moving ahead, I take pride in telling you as well that we are also launching a new AI cost predictive model as well, and it would be predicting the cost as well as the nature of patient's criticality and the spending nature as well. So let's suppose if a patient is of XYZ criticality, we can predict that if a new patient comes with the same criticality, or maybe some other criticality, but it will be some prediction going on, and we can predict way earlier than the actual spend is being done, so that we can control it back, whenever we feel like it's going out of the boundary or out of the limits. And coming to the success portion of this, what I particularly see is that Prime is going very well with this, and all of the data is aligned and all of the processes are made. So things are quite streamlined, and reportings and dashboards and analytics is going very well. And new advancements as I said is also on the way. Let's hope for the best.
Let's definitely hope for the best. Thank you so much, Nehal. That was actually great and really informative. Hopefully, the hospitals will speed up their process and realize the urgency of following this TEAMS model.
Definitely. All right. Thank you for having me, Nida. All the best.
Thank you.